This is the PA projection of the skull, and we're going to be operating at 40 inches SID. We're going to have the patient position be erect or prone, and we're going to have the patient's forehead and nose leaning up against the wall bucky. We're going to have the MSP be perpendicular to the IR, as well as the OML be perpendicular to the IR, and the central ray is going to be coming in perpendicular through the skull at the nasion, which is right in between the eyes. And the technical factors that we would want are 12.5 for CR and 6.3 for DR. So this is the PA axial projection, also known as the Caldwell method of the skull, and we're gonna have our SID at 40 inches. And for this one, we're gonna have the patient position this similar to last time, and we're gonna have the forehead and the nose resting on the wall bucky, and we're gonna have the MSP be centered to the IR, and we're also going to have the OML perpendicular to the IR. And what's different about this one is that the CR is entering axially 15 degrees caudad and exiting the nasion. So that's still the CR, except we're coming in at an angle of Caldwell, of also known as Caldwell method. And we're going to have the mass technique be 14 for CR and 7.1 for DR. So this is the AP axial projection, also known as the Townes method of the skull, and we're going to be using 40 inches for the SID. And here we have the patient position either seated or supine, and we're going to have the patient's MSP lined up to the middle of the IR, and the patient's OML perpendicular to the IR, and the CR is entering the magnum forum, and it's entering caudally. So it depends which reference point we're using. If we're using the OML as the reference point, it's going to be 30 degrees caudally. If we're using the IOML, we're going to be angling 37 degrees caudally. So coming down like that. And we're going to be using 12.5 mass for CR and 10 mass for DR. So this is our lateral projection of the skull, and we're going to have our SID at 40 inches. And our patient position is going to be like this. Our mid-sagittal plane is going to be parallel to the IR, and our IPL is going to be perpendicular to the IR. And the central ray is going to be entering 2 inches above the EMA. And we're going to have our technical factors at 85 kVp and 6.3 mass for CR and 3.2 mass for DR. So this is the SMV projection of the skull, and we're going to have our SID at 40 inches, and we're going to have our patient position seated or upright, and in this case she's going to be somewhat seated upright, and her torso is going to be elevated. So how we want our patient position to be is we want her MSP to be perpendicular to the IR and her IOML parallel to the IR, and the central ray is going to be coming through the sella turcica, and which is going to be between the two angles of the mandible and approximately 3/4 of an inch above the EMA. And our technical factors that we would want are 28 mass for CR and 14 mass for DR.